Ever felt a strong need to pee, even after you've just emptied your bladder? Have you woken up multiple times at night to go to the bathroom? Have you noticed blood in your urine or experienced pain while urinating? If the answer to any of these questions is yes, it is important that you pay attention. These could be some of the silent symptoms of bladder cancer. Bladder cancer is a disease that affects thousands of people every year. It is estimated that in 2023, more than 80,000 new cases of bladder cancer will be diagnosed just in the United States, and almost 500,000 people will die worldwide from this disease this year. Although the mortality rate has decreased in recent years, bladder cancer remains one of the leading causes of cancer death in the world. The bladder is an organ about the size of a tennis ball hidden in the pelvis, with the vital task of storing and eliminating urine. That is the only role of the bladder, a silent muscular organ, but it can definitely make a lot of noise when we hold it in for too long. The urge to go to the bathroom. Under normal conditions, being a muscular organ, it expands and contracts at a steady pace, guided by a complex choreography of nerve signals. The urine produced by the kidneys reaches the bladder through the ureters. As the bladder fills, its walls stretch, sending signals to the brain through the nerves. Then, the brain interprets these signals as a need to urinate. The strength of the signal depends on the volume of urine in the bladder. When the signal reaches a certain threshold, we feel the uncontrollable familiar need to go to the bathroom. When we decide to go to the restroom, the brain sends signals back to the bladder, ordering the contraction of its muscles. At the same time, the urethral sphincter relaxes, a muscle that closes the bladder's exit, and finally, urine is expelled from the body through the urethra, completing the bladder's work and giving a feeling of relief and satisfaction. However, the signals the bladder sends to our brain don't always mean it's full. Sometimes the bladder may send false signals, like when we feel the need to urinate. After you've recently emptied your bladder, this can be caused by different factors, such as a urinary infection or an underlying medical condition, like cancer for instance. At other times, the bladder might lose its ability to contract properly, leading to urinary incontinence. This condition can be quite bothersome and affect the quality of life of those who suffer from it. Bladder cells, like those from any part of the body, can mutate and grow out of control, leading to tumors. This silent enemy can progress without us noticing, until some symptoms alert us to its presence. Next, I will mention the 5 silent symptoms of bladder cancer and talk about what to do about it, and good habits to try to prevent its appearance. 1. Blood in the urine. Imagine going to the bathroom and noticing a reddish hue in the urine. It could be a slight trace or a more intense color, as if a bit of strawberry juice has spilled, blood in the urine, or hematuria. It's a symptom we should not ignore. When it occurs, you must consult your doctor immediately. 2. Pain when urinating. That burning or stinging sensation when urinating, like tiny needles piercing the urethra, might be a sign of bladder cancer. The pain can be mild or severe, and it can vary in intensity throughout the day. You usually feel like you still want to pee, even after you're done. It's a maddening feeling, like something's missing. It can even be painful after going to the bathroom. 3. Constant need to urinate. Feeling like the bladder is full all the time, even after having emptied it recently, can be a sign that something is not right. The urgent need to urinate or frequent urination. It can be a frustrating symptom that interferes with sleep and daily activities. Cancer, as it grows, reduces the space available for the bladder to hold urine, since this space is taken up by the tumor itself. Therefore, each day that goes by, your bladder fills up faster and empties less, making you always feel the need to urinate. 4. Nighttime bathroom visits. Waking up several times during the night to go to the bathroom, or nocturia, may be another sign of bladder cancer. This need to urinate disrupts sleep and causes fatigue during the day, affecting quality of life. And finally, number 5. Urinary incontinence. The involuntary loss of urine, or urinary incontinence, is a less common symptom of bladder cancer, but can be a sign of advanced disease. it is important to seek medical help. If you experience this problem, it means your bladder muscle can't contract properly and you might leak urine or even let out most of it at any time of the day, making it truly uncomfortable. Going out socially without a diaper or some form of retention. The consequences of bladder cancer can be severe: pain, infection, kidney damage, and even death. However, hope is not lost. Early detection and proper treatment are the most powerful weapons in this battle. There are various factors that can increase the risk of developing bladder cancer. Among the most important are age. The risk of bladder cancer increases with age. Smoking. Smoking cigarettes is the main risk factor for bladder cancer. Exposure to certain chemicals. The exposure to certain chemicals in the workplace, like aromatic amines, can increase the risk of bladder cancer. Family history. Having a family member with bladder cancer may increase the risk of developing the disease. If you experience any of the symptoms mentioned above, it's important that you see a doctor immediately. Bladder cancer diagnosis is made through a physical exam, urine analysis and imaging tests. Bladder cancer treatment depends on the disease stage and the patient's overall health. Treatment options include surgery, chemotherapy, radiotherapy, and immunotherapy. There is no sure way to prevent bladder cancer, but there are some things you can do to reduce your risk of occurrence. Quit smoking. If you smoke, quitting is the best thing you can do to reduce your bladder cancer risk. Avoid exposure to chemicals. If you work with chemicals that may increase the risk of bladder cancer, take steps to protect yourself, such as using personal protective equipment. Drinking lots of water. Drinking lots of water can help dilute the chemicals in the urine and reduce the risk of bladder cancer. It is advisable to drink 2 liters of water a day, plus a liter for each hour of exercise you do. Maintain a healthy diet. Eating a healthy diet rich in fruits, vegetables, and whole grains can help reduce the risk of bladder cancer. It's also important to lessen the chance of infections, because frequent repeated bladder infections irritate the tissue and can predispose to cancer. If you want a video on how to eliminate urinary infections and make them disappear, let me know in the comment section. When I reach 1,000 comments, I'll get to work. If you want to learn how to create content like what you just saw in this video and make a living from YouTube, I'm leaving you a free class in the description section and the first comment of this video. Also remember that we have a channel for kids, 2V Kids. There we aim to raise our youth with transformative messages that will lead them to be better people and healthier children. We also have 2V in various languages. Among them are English, Portuguese, Swedish, German, and more. Find these channels in the recommended section of my main channel. Next, you'll see 2 videos that might interest you. Sending you a hug. See you in the next one.